quite proud of my brother Larry. He's going to be talking about some really important issues today and also tomorrow, and it is my pleasure to introduce my brother Larry Siegel.
I was thinking on the plane, you'll have to forgive me, I'm getting a cold or getting over one, so my voice doesn't carry too well, but I was thinking on the plane as I was trying to get here yesterday that I do a lot of, over the last 30 years, I've done a lot of professional presentations, and this was going to be the first one where my entire family was going to be sitting there watching me, which actually made me slightly more nervous than doing it professionally. Anyway, just quickly so you understand where I'm coming from. I'm a pediatric psychologist, and I've basically spent the last 30 years of my career, both clinically and in terms of writing and research, working in this area, and have spent a lot of time providing counseling to children and adolescents and their families with many different kinds of chronic and life-threatening medical conditions. So this is an area that is sort of near and dear to my heart, and hopefully I can share some thoughts with you about some ideas I have, and I'll be talking to you tomorrow about some other issues. But what I'm going to talk about today are some general issues about sort of behavioral and psychological strategies for managing pain and stress associated with medical procedures, hospitalization, and the like, and a little bit about pain control, but more the issue of pain control in the context of more acute kinds of procedures. And as I understood the conversation when the earlier presentation on pain, it sounded like the issue of sort of chronic pain, at least for most people, doesn't seem to be a significant problem at this point. Although many of the procedures we're talking about are certainly applicable as adjuncts to medical treatments in working with children and adolescents with chronic pain. I'm kind of curious here for show of hands, how many people here find going to medical visits, to the doctor, being in the hospital sort of something that is a dreaded sort of procedure either for you as parents or for the children, and kind of need some help in that area? Okay, a few, about half maybe, okay. Actually for the parent, and we'll talk a little bit about that because many of the procedures that I'm talking about today actually parents can use too. And we're going to talk about the importance of parents in all of this because one of the issues that I want to stress is that children, particularly younger children, but older children too, certainly read our emotions very fast and very quickly, and if we're uptight and distressed, they can respond to that, and that doesn't kind of help them deal with things. So these are a lot of procedures that parents can use because it's difficult to watch your child go through difficult and painful or invasive procedures. First of all, let me just start out by saying that pain is really a very subjective sensory experience. We don't have meters that really measure pain. So the individual has to report to us what level of discomfort that they're experiencing. And even with children as young as 4 and 5 years old, I find that it's useful to sort of have a vocabulary where you can be on the same wavelength with them in terms of understanding their level of experience or discomfort and pain. And what I like to do is to ask children, with younger children you can use sort of on one end, sort of on a rating scale of 1 to 10, one end being sort of the sad, unhappy face, and on the other end, sort of the happy face, asking children to rate their level of discomfort or their anxiety or distress about what they're sort of experiencing so we understand what they're at. And what I sort of get a marker by saying to children, well, tell me the least, let's talk about a time when you didn't experience any pain or you weren't upset about something, and that's basically either a 0 or the unhappy face, and the most distressing, painful thing that you ever experienced, and that's sort of a 10, or the other, I guess, the reverse. And that's a good way to get a sense of what the child is experiencing, because it gives you a marker even when a child is having other kinds of pain experiences. you can feel a sense of relief or concern depending on saying, well, give me an idea of what's the pain like now? Is it a 5? Is it an 8? Whatever it is, so you have a sense of kind of where they're at so that they can communicate with you about the vocabulary about pain. Another thing we know is that anxiety and distress absolutely increase pain perception. You've probably experienced that yourself. Who here probably dreads going to the dentist? There's probably, I deal with a lot of dental phobic adult people myself also. And so I understand that concept. And when you just think about it, when you're uptight and you're nervous and your muscles are tight and whatever, you're more apt to experience discomfort and pain, and you're more apt to also be focusing on the pain sensations. And so it basically goes hand in hand that one of our goals is to minimize pain and distress in these children and at the same time enhance their coping ability. So we want to be doing two things. We want to minimize the pain and distress and also enhance their coping abilities. And a lot of what I'm going to talk to you about briefly today is teaching some of these coping skills or having other professionals work with you to help your child do that. My feeling is in this area, a little preparation goes a long way to preventing pain and distress, and that there are a lot of behavioral and pharmacological options available today that can be used in medical settings. One of the other things we know, and I can say that it's certainly not true of the physicians we've heard present today because they're sensitive to this issue, but a lot of times physicians, even some pediatricians, are really not tuned into issues of children's distress and dealing with pain. Interesting surveys have been done of medical practitioners, pediatricians, family practice doctors, people who work with children, to ask them their understanding of how much children experience pain, even infants and young children. And even today, there are a lot of misconceptions about the fact of whether children do experience pain, and we know even infants experience considerable pain during medical procedures, and that there are ways of reducing the distress that they can go through. We also know that over time, people get sensitized to these things. One might think that from a pragmatic sense that the more you sort of go through these things, the more you get used to it. But we also know the opposite is true, that particularly for children who go through repeated medical procedures, particularly those that are pretty invasive or distressing to them, they get sensitized to it. That is, they get more distressed over time rather than sort of getting habituated or used to it. And there are very simple things that one can ask a doctor to do, and I think this is one area where parents really need to be advocates for their children. I know we're going to hear in a little bit about being advocates for your child in getting help for disability benefits and other areas and in education, but this is also an area where parents can be very useful. You know what your child's responses are, you know what your child's reactions are, and there are certain things that one can request. For example, I've done a lot of work in the past with children going through cancer treatments, and they have a lot of repeated kinds of very unpleasant procedures done to them. And there's a topical cream that's created about 5 or 6 years ago, at least that's out on the market now, that can be regularly used, called EMLA. It's a topical anesthetic, and if you put it on and wait about 10 minutes, the area is very numb and the child experiences minimal sensation from whatever the needle procedure is or blood drawing or whatever. You just have to hope that the medical staff are willing to wait the 10 minutes in order to do that, and sometimes it's worth requesting that. So I always like to throw that into parents as something that one can do to help. The other thing is that for many of these children, we actually see what I would call phobic reactions. It's not just really anxiety. It's true, what I would call a true phobia. They try to avoid it at all costs. They get sick to their stomach and vomit when they have to face going to the doctor, facing these procedures. And there are many techniques that behavioral practitioners and psychologists have in their armamentarium to help you work with a child or even an adult who has these kinds of problems. There's no reason today that anybody should have to suffer in that way and be so absolutely distressed that they get sick to their stomach and throw up because they're anticipating going in for these procedures. And this is one of the things that we find, that over time people develop anticipatory anxiety. They get themselves so worked up even before they go to the doctor or the dentist that by the time they get there, they're absolutely complete wrecks. And so it just makes going there, and unfortunately, you know, adults have a little more control than children do, but unfortunately a lot of adults avoid seeking medical treatment for that very reason, because they're very avoidant and fearful of going through those kinds of procedures. And it's certainly not something that you want to have your child experience. Anyway, what I want to do is briefly talk about some strategies for helping reduce children's pain and distress, particularly going through more acute medical procedures. And I think some of these things are things that, even though I'm going to talk to you about and you can read about, probably really need to be done with more trained experts in the field and require a lot of practice for use. To really get used to doing these things, so that when the child really has a chance to use them, that they can feel very comfortable in using these procedures. But I can tell you, I've used all of these with children, and they work to various degrees. If you have people helping to coach the child, remind them to use it, and let them practice. In terms of the issue of preparation, I think it's important to let children know what to expect. One of the things we know from a lot of psychological literature is that predictable stress, predictable events, are, as stressful as they may be, are a lot less distressing to us as human beings than things that catch us off guard that we really don't know about. And therefore, again, depending on the child's age, it's important to give them a sense of what it is that they're going to experience. For example, telling them procedurally what will happen in terms of the order of things, what they might experience in terms of some of the sensory experiences, what it might feel like. What it does is it allows the child to gain some sense of control over what's going on by giving them some predictability and not sort of catching them off guard. In terms of the motivation and messages, some children, particularly younger children, in the beginning will benefit from some kind of incentives or rewards for going through something. And again, it's not using bribery, it's just helping the child to get into the situation and to try out, again, not just sending them in there, hopefully teaching them some of the skills we're going to talk about in just a minute, but teaching them the coping skills and getting them to try out and use some of those, and doing things like praising them for trying some of these procedures, using stickers, whatever it is, you know, little rewards like going out and having ice cream afterward, by just making an effort at trying to deal with the situation. It doesn't mean that they're not going to cry or maybe not be distressed by it, but giving them some opportunity to really get through it in a way that they have something else to look forward to. In terms of the messages, one of the things that we know about, as human beings, we're cognitive animals. We think things. And our thoughts can not only make us feel happy, but they can also make us be upset. So if you go into a situation saying, okay, this is going to be absolutely god-awful, you know, I'm practically going to die, you know, having this done to me, you can imagine how you're going to feel by the time you get in there. You've worked yourself up, you know, into a frenzy over it. It's because, as human beings, what we tell ourselves in our heads definitely affects the way we feel. And it's just the other way around. If you help people to practice messages that are more adaptive and positive, for example, I know I can get through this, it's only going to be very short, yes, it might hurt a little bit, but it's going to be over with and then I'll be done and I can go home, you're going to go in with a very different kind of expectancy set. And this is kind of some of the things that you can help children and adolescents to learn, is what are some of the messages that they're telling themselves in their head, and helping them make sure that they're going to be more adaptive messages rather than things that are going to make them more upset. Again, For the parents, this is exactly the same thing for you to use too. For those of you who find it very difficult being there with your child, watching them go through some of these things, these are also the kind of self-statements that you kind of need to learn to help you get through these situations. Distraction and imagery. These are really very useful procedures and strategies for helping someone to deal with stressful situations. The goal of distraction is really to help focus the child's attention away from whatever the distressing event is or procedure is. And what it does is that it has the effect, because you're not focusing on the event itself or the sensations, to sort of pull yourself away from the perceptions of the pain and the distress. One of the things I like to do with children and adolescents is to do a lot of imagery. As I said, we're cognitive animals, and what we think has a big effect on our emotions and our affect, our feelings. So, for example, I ask children to talk to me about things that are very pleasant, comforting scenarios and events for them, and you try to pick something that's very specific and unique to that child, and you may have several options. There may be several imagery kinds of things that you can do. Some kids like to think about what it was like when they went to Disneyland. Some kids like to think about going to the beach. Some kids like to think about being at a baseball game. And what you do with that is get the child to really elaborate for themselves and for you what it was like when they were sitting there, what are they seeing, what are they feeling. You get them to close their eyes and really imagine that they're absolutely there. Now, some people like to call this hypnosis. I don't like to use the word hypnosis, because to me hypnosis implies sort of hocus pocus, somebody else is doing something to you, like waving the magic wand to your hand and saying, you're going to now quack like a duck. That's what people think about when they think about hypnosis. Hypnosis really is two things: teaching someone to be deeply relaxed and to go into themselves and use imagery. And so rather than talking about hypnosis, I like to talk about relaxation and imagery. And I found this really useful for even children over the age of 7 and 8 who are cognitively okay and don't have developmental delays. They can get into this and practice it. And the more they practice it and the more they use it, the more that you can get them to do that while the procedures are going on. It's also great to use if a child is experiencing a bout of a flare-up of some kind of pain, for example, to help pull them away from it, go into use their, and I basically call it going to your special place, if you will, to use that imagery to help them deal with that. And I found that to be very useful. It's something best done oftentimes with a professional working with the child to help them to elaborate on this and practicing it, at least a couple times a day, where the child spends maybe 5 or 10 minutes, laying down in bed or laying in a chair, closing their eyes and practicing these images. For distraction, I've had kids use things like bringing a headset and a record player or a disc player. Sometimes looking at videos. I've worked with kids, for example, who going through cancer treatments and diagnostic procedures, for example, having to have like lumbar punctures done or spinal taps or bone marrow aspirations. And we actually have set up situations where the kids are sort of playing video games while this is going on, really as a way to truly distract them from what's going on. And it really does help. And the most important thing is giving the child an opportunity to practice doing these things in a non-medical situation. In other words, so that they're not just trying it out for the first time when they go into the room, but actually getting them to do it. For example, we've had them, they go into the exam room, they lay down on the table, we do the video game in the room where it's going to happen, and they practice it they practice doing it at least a couple times, so they're really comfortable with it. And then when the real procedure has to be done, they can feel confident that they can use it. And I think that's the other point that I want to make, is that it's for want of a better term, in psychology, we call it self-efficacy. Self-efficacy is the belief that you can do something and succeed and be confident at what you're doing. And we know that in this situation, the more self-efficacy that a child has, the more likelihood that they're going to be successful. If they really believe that this is going to work for them because they're confident in it, the more likely they're going to try it, and the more likely it's going to be at least somewhat successful in helping to reduce the distress that they experience. So we want to do everything possible to increase that self-efficacy, and that's through practice, rehearsal, and that sort of thing. And that brings me to the next one, which is modeling and practicing. Kids learn very well from demonstration, and so it helps for us to demonstrate as adults some of the things that they can do, getting them to try it out, rehearse it, and practice it until it becomes very rote. I like to use the analogy of, particularly to older kids, about learning how to ride a bicycle. You know, in the beginning you get on a bicycle, you're very awkward. You think about how you're holding the handlebars and turning the pedals and so forth and so on. Well, after a while it becomes so automatic, it's like, whatever, you get on, you sort of ride. Well, it's the same thing with this. The more you rehearse it, the more you practice it, the more you do it, you're going to be comfortable, and it's going to feel like second nature to you to be able to do that. Physical contact and exercises. We know that human touch can be a very therapeutic experience, and in fact there's a lot of research now being done literally looking at human touch. Some colleagues of mine who are, they were at the University of Miami, were doing some unbelievable things with infants and young children using touch and actually measuring physiologically preemies and other young children, their reactions to human touch in terms of acting as a stress reducer to all the things that preemies face when they're in the incubator and the procedures that they go through. And the same is true for older children and even adults. So soothing contact, rubbing the child's hand, rubbing their back, can be not only a distractor but a way of helping to sort of bring on the relaxation response. Debriefing, by that I mean that it's really the child benefiting from the opportunity to wind down after the procedure. Not just having the procedure end and you pretend like nothing happened and you sort of walk out of the room. Praising the child for getting through it and doing the best job that they can, reassuring them that it's over, talking about the experience briefly and how it was for them, and basically helping the child to gain a sense of control so that they can think about it, and that when the next time happens, they're more confident. And then finally, the issue of your participation. Parental participation is essential in almost all of this, in terms of helping to cue the child, to model it for them, to get them to practice, where appropriate to be in the room with them if the child is going through procedures, and to present as much as you can a calm, soothing, matter-of-fact attitude yourself in order to help the child to basically get through the procedure. Okay, so in summary then, let me just briefly go through these things for learning to cope with painful, distressing procedures. Basically, you want to have a strategy or a plan and think this through. You know your child better than anybody else, and this is what's important in terms of helping medical practitioners, is to sort of help share with them some of the ideas. Teach your child how to assess pain. Like I said, the rating scale can be very helpful. You have a common language and you really understand how a child is experiencing something. Learn your child's distress signals in terms of what, sort of the early signs of things that are getting them distressed, because the earlier that you can break the cycle, the better in terms of having it not turn into sort of full-blown panic attacks, which sometimes individuals have. Identifying and addressing your child's phobias, that is the things that are really freeze points for them or stumbling blocks, and again, your own issues in this situation, and identifying those to know what things may distress you so that you can monitor those and make sure that those feelings of distress don't spill over to the children. Give your child options, choices, and control whenever possible. Again, very important. When children feel in control of something, they're much more likely to deal with it in a more calm manner. Motivate your child with positive messages and small rewards. Prepare your child for procedures and build in opportunities for practicing and modeling, particularly in non-medical situations in the beginning so that they can get used to it. Inform the staff of your child's special needs or preferences. Again, the issue of you're the experts on your child. Don't hesitate to share with them what kinds of things may make it easier or better for their child, or things that they might try. Make use of distraction, imagery, and breathing techniques. Allow your child time to wind down and to talk about fears, thoughts, and experiences after the procedure. And finally, and importantly, give your child, yourself and your child, the gift of knowing that you can get through these painful and distressing times intact. I think that, you know, when everybody knows they can get through it, even if it's going to be difficult, and that everybody's reassured about that, that's the most, I think, relieving thing for everybody, even if on a very short-term basis it's an uncomfortable situation. Anyway, any questions, issues, comments about this? The other thing I want to tell you is that there are a whole group of psychologists out there these days called pediatric psychologists. Many of them work at major medical centers, but not necessarily just at major medical centers. And the handout that I gave you, and you'll see it's also for tomorrow's talk, there are some phone numbers, for example, and contacts in terms of email and so forth. The American Psychological Association, the American Pain Society, the Child Life Group, all of these organizations have people who know how to do these things and are interested in these things, particularly not only in terms of working with children on an outpatient basis, but also in the hospital. And even if you live in a rural area where you might not have access to a major medical center, you may still be able to find somebody that you can work with on a short-term basis who has the skills and abilities to help you with these areas. And I think that it's important to know that you're not alone out there, but there are resources to help you with these things.
On your last reference and the website address, is that in Seattle? Or because it doesn't, Children's Hospital Medical Center? Seattle?
Yes, I'm sorry. Yeah, it's in Seattle, Washington.
Is it two T's in the web address or just one? I was thinking Seattle had two T's.
It does.
It does?
Yes.
Okay.
It does. Yeah, the website, and it is Seattle, Washington.
Okay, so
Yeah, right.
and it's Seattle.
Yeah.
Okay. And one of the things that we found, our daughter's 17 that was affected by transverse myelitis, and we have a daughter that's 15 and one that's almost or 11, and we've noticed it's very much so impacted the other two, the younger two, and
in terms of their fear of going to see a doctor themselves?
No. Just how do you? I guess this workshop will probably be just as valuable for our middle daughter, who's 15, that it will be for.
Is it kind of sibling issues?
Well, yeah, it's more with including her older sister. Now they look about the same age as far as in school and stuff, but yet I feel like that middle one kind of wants to get away from, because she does help so much with us.
Tomorrow, Sandy's got me talking for hours and hours and hours on this particular topic.
Okay.
Hopefully my voice will hold out. And so tomorrow we're going to talk about family issues, important family issues. And so I will try to address that, and if I don't get specific to your issue, then we can talk about that.
Yeah.
This might pertain to your talk for tomorrow, but like I said, my daughter is 7, and she's definitely getting to the stage where this summer coming to me, very, happy child, but has come to the realization that she can't run the bases like her friends, and wanting so much to do that, and the reality that she can't do that, and has come probably 3 times where she's just cried. And as a parent, I want to know that I'm responding if there is a correct way, and how I let her release that emotion, hug her, and confirm her that it is unfair and that this is something that's very difficult to accept. But is
one of
your
the topics in this very long presentation tomorrow is on the issue of building self-esteem in children with special needs. And I think that this very much relates, I think, to that particular topic. And so hopefully we'll talk about that. And again, if we don't get directly to that, then we'll have Sandy wanted me to make sure that I had a lot of time for discussion in this presentation tomorrow, because I know that this gets into a lot of general issues that parents with children with special needs have. So we'll have a lot of time to talk about that tomorrow.
We're going to have to move on here, Larry. Thank you so much. Let me explain what's going to happen tomorrow, because we need to get Ann and Annette going here, because they have things they need to do yet this afternoon. Thank you, Larry, very much. What I have planned, if it's not, see, I thought the program agenda was just so clear, but it's clear in my head, obviously. What we're going to do tomorrow afternoon is Larry's going to start, I think, at about 2:30, and he's going to give a short presentation on all those very long, complicated issues that we've identified here, and that's going to morph quickly into a discussion that we are going to have where you can ask these questions. And I know Larry has really just years and years of experience working with families about these issues, and he and I have talked about this, and we know that you have strategies that you're going to be able to share with each other as well about what kinds of things have worked, and to be able to share your experiences as well. So we're really talking about a 2-hour extravaganza this afternoon, tomorrow afternoon, to cover those.